hormone replacement therapy decreases the risk of atherosclerotic heart disease by 50%. About as many women in the United States die of problems related to hip fracture due to osteoporosis, another problem with menopause, and hormone replacement therapy is the single best preventive treatment for avoiding hip fracture. If there's one thing that women are more frightened of than breast cancer, it's cognitive decline, senility, Alzheimer's disease, and the only treatment we know in a preventive fashion is estrogen, which has been reported to decrease the risk of cognitive decline by 25 to 65%, depending upon which study you read. It also decreases the risk of diabetes, it decreases the risk of colon cancer, and perhaps most relevantly, it is the single best treatment for the menopausal symptoms that affect up to 75% of women, and that usually last a median of 7.5 years, longer for women of color. Nothing comes close to estrogen for decreasing those symptoms.
So we've got all these amazing benefits, both for symptom relief and for preventative healthcare concerns. So why is there so much misinformation and fear out there by the general public and also with physicians? Because most women come to me and their doctors don't know anything about it or are very against it or fearful.
We are a risk-averse species. We are concerned when we hear of something that causes a risk, and we avoid that something, even if doing a positive action is less risky than doing nothing. About 44% of menopausal women in the United States in the early part of this millennium, around 2000, were taking hormone replacement therapy. And in July of 2022, there was first a press release and then an article published in the Journal of the American Medical Association reporting the results of the Women's Health Initiative, claiming that hormone replacement therapy did many, many bad things. And we can get into those claims, but just about every one of those claims has been walked back. But because one of the claims was breast cancer, even though at that time, estrogen was not associated with any significant increased risk of breast cancer, that was the headline in the New York Times. And the rate of prescriptions for hormone replacement therapy fell from about 44% to less than 5%, where it remains today.
So much fear from an almost over 20-year-old study. And, are there any points, this could be a whole webinar itself, but any main points that you want to tell the viewers about that study, just so that they kind of have a basis going forward?
I will, but feel free to cut me off if I become.
I know, it's a can of worms.
Can of worms. So yeah, in a tiny nutshell.
Okay. First, the population that was treated had a median age of 63. Most women start hormones around 49 to 51, which is when the great majority of women go into menopause developing symptoms. And what we now know, and that the Women's Health Initiative investigators confirm, is women who start hormone therapy, estrogen or the combination, around the time of perimenopause have no increased risk of breast cancer. Even women who are BRCA positive with abnormal BRCA mutations. We know that the benefits that I already elaborated are most prominent within 10 years of a woman's last menstrual period, so that would be the best time to start hormone replacement therapy.
So you mentioned BRCA mutation carriers let's just also lump in there women who have a higher risk of developing breast cancer due to, say, their family history, or maybe they have very dense fibrocystic breasts. Women are often told that raises their risk. They may have had some abnormal, they may have had biopsies that were found to be benign, but increase their risk. So can you just give some guidance about what the science tells us about those women versus the average woman and the risks of hormone therapy in terms of breast cancer?
Thank you for the way that question was phrased, Corinne. You talk about guidelines, and guidelines aren't commands. Guidelines are boundary recommendations that will work for a large percentage of patients. I'd like to stress that these aren't candies that we can give out to everybody who wants them. This should be a discussion with your healthcare practitioner. But the best guideline is the overwhelming majority of women would benefit from taking this treatment that we are discussing.
And as you mentioned, yeah, guidelines are simply put guidelines, but a lot of women are surprised, and I think doctors don't even realize that organizations like NAMS, like ACOG, have some very clear guidelines that even women who are BRCA positive, that the preponderance of evidence shows that hormone therapy doesn't further increase their risks of breast cancer.
That's true. Thank you for clarifying that. That's true for women with a family history of breast and/or ovarian cancer. That's true for BRCA-positive women. And there are other genetic abnormalities that don't get as much publicity, but it seems to be true for them as well.
And then just quickly, so women understand, when we talk about hormones, there's systemic hormone therapy in like pills or patches, and we promote and endorse FDA-approved versions of that, right? Not pellet therapy. But vaginal estrogen, it's local, it's not systemically absorbed. Can you just say a few words about that? And then let's talk about the black box warning.
Easily. And I can throw in the black box warning in the answer, which is after that first press conference and the JAMA article, the FDA put a black box warning on every product containing estrogen, and that includes transvaginal as well as oral or patch therapy, saying this preparation has been shown to increase the risk of cancers, breast cancer being implied, and it's certainly the one that got the most publicity. At the time the Women's Health Initiative was published, I mentioned there was no evidence that estrogen alone increased the risk of breast cancer. Now, after over 20 years of follow-up, what the Women's Health Initiative reports is that estrogen alone decreases by 23%, and it's a significant decrease, the risk of breast cancer development, and decreases by 40% the risk of death from breast cancer.